Moderna is in talks with the United States government to develop vaccines for Ebola and other viruses. Medicare is rolling out a spending cap for patients, and a new study finds that for some patients, surgery may no longer be a necessary part of treating breast cancer. These are the stories we'll cover on This Week in Healthcare Tech. Hello and welcome to This Week in Healthcare Tech, where every week we bring you the hardest hitting news from the intersection of healthcare and technology. First up, Moderna became a household name during the COVID-19 pandemic as the developers of one of the coronavirus vaccines. And now they're closing in on a deal with the U.S. Department of Defense to develop vaccines for a number of biological threats. One such threat is the Ebola virus, which has been in the news recently as a result of an ongoing outbreak in Uganda. Moderna's Ebola vaccine would be effective for the Zaire strain and the Marburg virus, a cousin of Ebola. Next, Medicare, a federal health insurance program predominantly aimed at insuring adults who are 65 or older, has announced new spending caps that will go into effect by 2025. The cap stipulates that no one using Medicare will have to pay more than $2,000 in a given year for their prescription drugs. Though this will no doubt offer financial relief to many, questions remain about the likely net impact of the spending cap. Because it applies to drug expenditures and not to expenses related to hospital visits, outpatient procedures, or healthcare offered at home, users of Medicare could still face extremely high costs if their health takes a turn. Finally, there could be good news for those suffering from breast cancer. Traditionally, the response to a breast cancer diagnosis has been to throw everything at the problem: radiation, hormone treatments, surgery, and anything else that might help. But according to a recent study published in The Lancet, a subset of breast cancer patients might respond so well to chemotherapy that surgery is no longer required. The study examined a group of patients over 40 who had one of two types of breast cancer. Biopsies following chemotherapy showed that 31 of them had seen a cancer reduction great enough to allow them to skip surgery. Even though this result doesn't apply to everyone with the condition, it could mean that many patients can avoid the nerve damage, infections, and other complications which can result from surgery. That's it for this episode. Tune in to This Week in Healthcare Tech next week for the latest news. And don't forget to like this episode, subscribe to the channel, and share it with your friends. Thanks for joining me, and until next time.